So can I welcome every participant that have joined already? Good evening, a special good evening to you. We welcome you to today's midweek health awareness talk. You see, every week we are consistent in bringing to you one health issue or the other. And we consider how important they are and how much benefit you can equally derive from these health talks. Anyway, I want to welcome you once more. My name is John Ekperijin, your host for today. And with me, the team of the medical personnel, the medical team, made up of Dr. Manua. Thank you so much, Doctor, for your contribution all the way from Maiduguri. Dr. Abubakar, we thank you so much. Then we also have Mrs. Justina Ekperijin, a pharmacist, all the way from Canada. Well, thank you for your contributions, your participation. And we also have yes, Mrs. Judy, welcome and thank you so much. And of course, our big brother, Dr. Clement Idigo. That is the big brother in the house himself. Thank you so much, Doctor. And like we said, we need to incorporate and bring in more medical personnel into this medical team to get you the best of the issues and the best of personnel. So good evening and welcome. Tonight, we're picking on very crucial medical issues that concerns women mostly. I'll tell you about 90% of this issue, women. I'm aware that some men do have this breast lump as well, and some even have breast cancer. So it's a bumper presentation because for the first time we're bringing in two different health issues, the breast cancer and the cervical cancer. Don't forget, the month of October is Breast Cancer Awareness Month, and so we cannot leave out an awareness talk on breast cancer. And we just added in, like we call it the JARA, that is the cervical cancer that also affects women. So we tagged it avoiding breast and cervical cancer and the better management approaches found. Guess what? Who is handling this special edition? This is by popular demand. She did marvelously. In fact, her presentation was fantastic. If you remember, if you've been following us, the issue of infectious chronic diseases, we're talking about hepatitis, the liver damage, and all that. She did wonderfully well. And so by popular demand, we have contacted her to handle this issue today. Who am I talking about? Dr. Mrs. Priska Chineye Ifidi Iloje. In fact, we are always very excited to have you. And please oblige us each time we call on you. She has a BSc Parasitology and Entomology, Unande Azikiwe University, Oka, Anambra State, MBBS, College of Medicine, UNN Enugu, 2018. And she is the Registrar, Family Medicine, Chukwuemeka Odumegu University Teaching Hospital, Oka. And so here we are today to brainstorm and look at how we can prevent this issue. We also invited men because I am aware that the issue of the cervical cancer, men need to listen because that will do with promiscuity and indiscriminate sexual activities. And so we need to work together as a family to ensure that this issue is brought nail. So ladies and gentlemen, I'm aware that our speaker is in the house already. That is Dr. Mrs. Priska Chineye. And over to you, madam. Share your screen and then go ahead. Thank you very much for coming. Yes, you can share your screen. Hello? Can you unmute yourself? Okay. Oh, fine. I can't hear you yet.
Okay. Good evening, everyone.
Yeah, good evening. Good evening.
Yes, thank you very much for the introduction. I'm very happy to be here. I had a good time the last time we had this talk, and I got a lot of feedback. In fact, a lot of people came to the hospital for their checkups, which was very encouraging. Wow. So thank you very much all for coming today. I am Dr. Mrs. Priska Chine Ifadi-Ileje, a family medicine resident doctor at Chukwuemeka Odumegwu Ojukwu University Teaching Hospital here at Awka, Anambra State in Nigeria. I hope we had a good day today. So like I've already been introduced, today we're talking about breast cancer and cervical cancer. These are two major topics, but I'll try as much as possible to give you the basic information you need about it and how we can avoid having this cancer. And if by any chance you know someone or you yourself already have had this cancer, we'll tell you one or two more things you can do about it, okay? So stay tuned, let's get right to it. I'll be taking questions at the end of the presentation because of time. So please note your questions so that I can address all of them, okay? All right. Okay, so this is our outline. We'll be talking about breast cancer, talk a little bit about the breast and the risk factors. We'll also talk about breast self-exam, which is very important, and then cervical cancer, and then we round up. So what is cancer? Cancer. Everybody talks about cancer. Cancer by WHO is defined as a large group of diseases that can start in almost any organ or tissue in the body when abnormal cells grow uncontrollably and they grow beyond their usual borders and invade other cells, other tissues, other parts of the body. Then we say that someone has cancer. And we know there are different cancers. We know cancer of the liver, the lungs, the breast. So cancer is always named after the part of the body where it starts, because it usually spreads with time. Now, cancer has remained the top of the list of diseases that are reducing the welfare and the wellness of persons across the world, especially in developing countries like Nigeria. And according to the Global Cancer Observatory, Nigeria has one of the highest cancer mortality rates in the world, which is very sad because approximately 4 out of 5 cases of cancer results in death in Nigeria. So you see why it's very important for us to bring this health talk today, so that we'll learn what we can do to avoid this cancer, because having it increases your chances of dying from it in Nigeria. Now, according to statistics by WHO, cancer was responsible for 78,800 deaths in the year 2020, with women often bearing the brunt, as breast and cervical cancers are responsible for most deaths by cancer in Nigeria. So we go straight and talk about breast cancer. Breast cancer, like we already defined cancer, is the abnormal growth of cells in the breast tissue. It is currently the most common cancer worldwide, with 2.26 million cases and about 685,000 deaths recorded only in the year 2020. This is very high, and I'm very sure the numbers must have increased by now. And it's the most common cancer among women, both in the developing countries and in the developed country. And it's a major cause of public health concern. That's why we'll keep talking about it every October and every other day of the year. Now in Nigeria, breast cancer cases used to be low. I don't know whether it's because we weren't testing that much or because of the healthcare we had as at then, but now we are seeing it increasing as a result of urbanization and lifestyle changes, and is the leading cause of cancer deaths in Nigeria, while liver cancer is the second and prostate cancer is the third amongst the causes of cancer deaths in Nigeria. So as we well know, October is the Breast Cancer Awareness Month. So we dedicated this month to keep talking and educate people more about breast cancer. We'll talk about the breast. I hope you can see my pointer. So this is a cross-section of the breast tissue. You see that it's lying on a muscle, the chest wall, and it has fat cells around it, and some, these are the glands, the mammary glands. You see some white lines that are the ligaments holding the breast tissue together, and then the glands open up into the what's it called? The lactiferous ducts, and these ducts are what opens up in the nipple and releases the breast milk. So this is basically what the breast tissue is all about. And it has blood vessels, of course, and nerve supply and lymphatic drainage as well. Now, these mammary glands are modified apocrine sweat glands, which means that they produce some fluid. Of course, we know they produce breast milk. And the breast tissue, they are structurally dynamic in the sense that the anatomy of the breast changes according to the woman's age, the menstrual phase of the woman, and the reproductive status. Basically, this means that before giving birth, the breast tissue is filled with fat cells, what we call adipose tissue. And then during pregnancy, these fat tissues are being replaced by the mammary glands, preparing to produce breast milk. And then once the baby is delivered, then the prolactin hormones pushes the breast to release, to build up breast milk, and oxytocin helps in releasing it. So that's basically how the breast functions. And then we also have the nipple, which also helps in the functioning of breast milk and other parts of the breast as well. So this is a picture of a breastfeeding mother. Generally, people think breast cancer only affects females. Yes, most of the time it does, more than 90% of the time it does. But we also have that 10% that men also come down with breast cancer. And I will still show you the signs and symptoms of such cancers. Now, let's talk about the types of breast cancer. There are so many types of breast cancer, but the common ones that you may hear about are, first of all, we'll talk about the ductal carcinoma in situ. Yes, big word. But that basically means that inside the duct, that is where the cancer is, and it has not spread. So we classify it as either non-invasive or pre-invasive or early stage of breast cancer. The good news about this is that at this stage, it can be cured. It can be 100% cured. So we push people to keep doing some things I'll talk to you about to make sure that we don't get the cancer. And even if we do, we detect it at this stage when it's still ductal carcinoma in situ, so that we can do something about it. Now, we have invasive breast cancers, we have triple negative breast cancer, inflammatory breast cancer, Paget disease of the breast, which basically affects the nipple and the areola, then angiosarcoma, phyllodes tumor, and the rest of them. So what can we do to prevent having this cancer? Before we are able to know what to do, we need to find out the risk factors. What puts you at risk of having a breast cancer? We have the modifiable ones and the non-modifiable ones. So the modifiable ones are the ones you can do something about. We have being overweight and being obese. So we have numerous studies that have shown that there's a correlation between being obese and overweight and breast cancer. So what can we do? We exercise, we watch our diet. Now we talk about smoking. Women who are active smokers, especially those that are postmenopausal from 55 years and above, and the ones that are prenatal, women who haven't given birth before, that smoke, they have an increased risk of developing breast cancer. Now, see the part most people don't think about. Exposure to secondhand smoke has also shown to be a risk factor for breast cancer. What is secondhand smoke? Secondhand smoking is when you have, like, you go out in public places, someone is smoking, you're inhaling the smoke, you're not the one smoking. Or you live with a partner or a family member who constantly smokes at home, and you keep inhaling the smoke. Now you are at risk of having breast cancer as well. Of course, alcohol, excessive alcohol consumption causes a lot of problems in the body, which includes having increased risk of having breast cancer. Then we talk about cosmetic chemicals. Aluminum, parabens, triclosan. These are substances that you find in deodorants and antiperspirants. So numerous studies have been done and are still ongoing and have been linked to these chemicals having increased chance of causing breast cancer in women and men who are using products with these substances. We also have other products as well, in other cosmetic products that have also been linked to cause breast cancer or increase the chances of having breast cancer. Now, pregnancy. Now, we talk about women who have had their first child at an older age. Studies have shown that they've had an increased risk of developing breast cancer as well. Physical activity. Of course, lack of physical activity is not good for the body because it also puts women at risk of developing breast cancer and developing other health challenges as well. A study was conducted that showed increased physical activity among women between 50 and 79 years. And this increased activity reduced the risk of developing breast cancer among these women who are also postmenopausal women. This shows how important physical activity is as well. What are the non-modifiable risk factors? Risk factors that you really can't do anything about. Gender. We know that breast cancer affects majorly women and of course some men, and we can't do anything about that. Your age. Breast cancer incidence increases with age and usually peaks at menopause. Family history of breast cancer. So studies have shown that if you have a family history of breast cancer, you are at a higher risk of also developing breast cancer as well. And then also some genetic factors, if you have them, you are also at a higher risk of developing breast cancer. So these non-modifiable risk factors, we really can't do anything about. So we focus on the modifiable risk factors that we can control and change to have a good outcome. So we talk about the breast cancer symptoms. What and what will you be looking out for so that when you see any of these signs and symptoms, you come to the hospital immediately? We check for nipple changes, bloody discharge from your nipple, lumps in the breast, change in breast color, then pitting of the breast skin, and breast or nipple pain. So if anybody has any of these symptoms, we encourage them to come to the hospital so that we can take a look at them and then see what we can do for them. Now, see a picture of a normal breast, what it looks like, the skin color and all. You then look at this picture. I hope you can see my pointer. You see all these dimpling on the skin. This is what we call pitting of the breast skin. When you see this kind of feature on any breast, this is highly suggestive of cancer. So we encourage people who have this to come to the hospital immediately. And you also see that the nipple has gone inside. This is what we call nipple retraction. So change in the nipple, any discharge, any change in color of the breast, any lump, then you know that you're having symptoms of cancer and you need to come to the hospital. Here is a picture of, here are pictures of male breast cancer. So for those who think that breast cancer only affects females, we also have males in Nigeria who also have breast cancer. So it looks like this, having a lump or a swelling or a color change or nipple retraction. So these are the stages of breast cancer. Initially, it is the stage where it is only found in the breast tissue, just here. Then stage 2, it has grown inside the breast tissue and affected more than one gland or one duct. And then stage 3, it has spread into the lymphatic tissue or the lymphatic channel that drains lymph of the breast. And then stage 4, it has spread into the lungs, which is the most common site for metastasis, that is for spread of breast cancer. It's most commonly spreads to the lungs. All right. Now, this information is basically for Nigerians because over 70% of cancer patients present in their late stages, stage 3 or stage 4. By the time it has spread to the lungs or by the time it has spread into the lymphatic channels, that's when most people in Nigeria present to the hospital, which we are trying so hard to change. Because, and this, when they present like this, we don't have enough facilities to treat this stage. And like I said, at this point, it becomes difficult to treat because there's a lot of money involved and some facilities that we need are not readily available. Most people who are diagnosed of cancer at an advanced stage because in Nigeria, people believe cancer is white people's disease. People still believe that. Some strongly believe that this cancer was sent to them by other people through juju or demonic attack or punishment sent to them by God for some reason. And then when they have these symptoms, they go and visit the traditional healers or go to churches, different faith-based centers where they believe they can get a cure instead of coming to the hospital. And then when they get there, they have different kinds of scarification marks they receive and different kinds of treatments that they receive. And of course, they won't work. So they end up coming back to the hospital when it's already at an advanced stage and when we can only offer palliative care. So we need to do a lot to educate the masses on the symptoms and signs of breast cancer so they can come to the hospital early enough when we can actually give them or do something to achieve a cure. All right, we talk about management. Basically, it's a broad-based management. The management of breast cancer depends on the stage of the disease. So general idea about the management is you see a sign or a symptom of breast cancer, you present to the hospital, we make a diagnosis by taking your history, asking about the risk factors, symptoms of the breast cancer. Then we do a clinical examination, examine you from head to toe, and then examine the breast, send you for routine investigations. We have to do a scan, check your blood workup, and then ask for a biopsy of the breast tissue, which will definitely give us the cancer cells if they are present. And then the treatment also depends on the stage of the disease because sometimes it will require surgery and or chemotherapy and or radiotherapy. Some types of cancer require the three, some only surgery with some chemotherapy, some will be chemotherapy, surgery, and radiotherapy. Actually, in recent studies, there's increased chances of getting a much better cure or a much better treatment by combining the chemotherapy and the radiotherapy. And we know that chemotherapy and radiotherapy also comes with its own side effects. What can we do to prevent breast cancer? We talked about it. We exercise regularly. Do not smoke. Do not hang around people that are smoking. Keep your weight down. Eat healthy food. Watch out for changes in your breast. Go for a mammogram. Limit your alcohol consumption. Limit exposure to pollution and all those cosmetic chemicals we talked about, and limit using hormonal medication, and of course, breastfeeding. We have come to breast self-examination, which is very, very, very important because this is the most effective tool to be able to pick out the symptoms of breast cancer before it gets to an invasive stage. So what are the steps? There are various changes to this breast self-exam, but basically what you need to do is inspect and then you touch. So we say you stand before a mirror and put your hands by your side and then take a look at the breast tissues. Look for any scar, any change in color, any change with your nipple, any of those symptoms that we've talked about. And then you raise your hands above your head and hold it behind your head. And then take a look at the breast again. This is raising up the muscles. The muscles are raising up the breast so that you can look under and to the sides as well. Looking still for changes in the appearance, any dimpling of the skin, any nipple retraction. And then you place your hands on your waist and tilt a bit forward and still look at the mirror to check for these signs and symptoms. And then you raise one hand up, use the flat, keep your fingers flat, and then use it to feel around the breast tissue, starting from around the armpit and go around the breast tissue. Then you squeeze the nipples gently to check for any discharge. When you're done with standing, you have to lie down and then start touching, raise up one hand and use the other fingers flat and firm and go around the breast again and check for any lumps and any pain or any other rash. And as well, at the end, you check for any nipple discharge. So this is another format these people, they started from lying down to standing. But basically, you have to stand, look at the mirror, feel, then you still have to lie down and repeat the steps again. What are we looking out for? We are looking out for any lump or mass, any enlarged lymph nodes. Lymph nodes are going to be under your armpits. So when you feel under your armpit and feel any circular or any round, firm, painful or not painful mass, you have to come to the hospital immediately. And then any changes in the breast size or shape, any dimpling, any scaliness, any nipple changes or discharge, is the nipple pulling to one side or going inside? These are things that we look out for when we are doing a breast self-exam. So I'm very happy that we have a lot of people in the house today. So this breast self-exam, we really promote it. We advise women to make sure that they do the breast self-exam. And now, as a family medicine physician, we also advise the husbands to also be in tune with their wives and help them to do this breast self-exam. Because if someone has breast cancer, it's not just the patient who is being affected, the family as well is also affected. So you as a husband regularly remind your wife to do a breast self-exam. As a woman, you remind yourself to do a breast self-exam, remind your family members as well. And if you want to get very busy in the bedroom and the other partner is not interested, you can always say, come and do a breast exam on me, and that could spice things up as well. So that's a bonus. So spread the word. All right, we'll talk about cervical cancer. I hope we learned a lot about breast cancer. So cervical cancer, I really like this picture. When I was looking for pictures to use, I found this very interesting because it's clear. So here, people talk about cervical cancer and people don't really know where the cervix is. So this is a picture of the womb, which we call the uterus. And this is the vagina here, this part that has the lines, okay? Now the cervix is here. This is the part of the uterus that connects the vagina to the womb, what people call the womb, where the baby stays. So the cervix is basically here. And when the cells here grow uncontrollably and become abnormal cells, it causes cervical cancer. So as an overview, cervical cancer starts at the cervix, which is here. And the cervix connects the vagina, which is the birth canal, to the upper part of the uterus, okay? All women are at risk of cervical cancer. And it most often occurs in women over the age of 30. All women. Why? Because this cervical cancer, what causes it? The main cause is human papilloma virus. And this virus is now known as a sexually transmitted virus, okay? So it's passed from one person to another during sex. And at least half of sexually active people will have had human papilloma virus at some point in their lives. But only few women eventually get to have the cancer anyway. I'm sure some of you have seen people who've had genital warts. So genital warts is also caused by human papilloma virus, type 6 and type 11. And we have more than 250 types of human papilloma virus. And a whole lot of them have been linked to cause cervical cancer. Now, to prevent cervical cancer, we recommend screening tests, regular screening, and the human papilloma virus vaccine. And cervical cancer, when found early, is treatable and associated with long life and good quality of life. So this is basically what I'm talking about. A healthy cervix looks like this, and a cervix that already has undergone some cancerous changes would look like this when you examine the patient. And the cervical cancer is mainly caused by human papilloma virus. What are the risk factors? What predisposes women to having this cancer? So we talk about early childbirth. With early childbirth comes early coitus. Early people who start having sex at an early age are at risk of having cervical cancer. Early marriage, the same thing, because they are at risk. They have more sexual encounters, and they're at risk of having cancer. Poor personal hygiene, nutrient deficiency, very important, because your body has cells that can help you fight away these cancers. That's why it's not everybody who comes down with cervical cancer. So if you eat well, get the right nutrients that you need, you have a good immune system to help fight off all these viruses. Low socioeconomic status, because low socioeconomic status comes with poor feeding, poor access to healthcare, and ignorance, and every other thing that follows it. So it predisposes one to having cervical cancer. Weakened immune system, I just talked about it. Smoking, you will never, in all cancers, smoking is a risk factor. So long-term use of oral contraceptive also predisposes one to having cervical cancer. Multiple sexual partners. Of course, we said HPV is a sexually transmitted virus. And so having multiple sexual partners, or having one partner who has multiple sexual partners, predisposes one to having cervical cancers. And then, of course, HPV is the virus, and then HIV as well. As we know, HIV reduces the immune system and predisposes one to picking up other infections. What are the warning signs of cervical cancer? What are we looking out for? What will you notice or see or hear that someone has, and you start thinking of cervical cancer? Unusual or recurrent frequent vaginal discharge. Some people keep having vaginal discharge, keep taking random antibiotics, keep complaining of the same thing. Come to the hospital. So we do some tests and find out if you're having a warning sign of cervical cancer, because we can treat it if it's early. So you come and we treat it. Now we'll talk about abnormal vaginal bleeding, heavier or longer menstrual cycle from the normal. So if you're not used to having heavier or longer menstrual cycle, and all of a sudden you notice that change, please come to the hospital. Discomfort while urinating. This could be a sign of a urinary tract infection or a warning sign of cervical cancer. Loss of bladder control, pain during intercourse, constant tiredness. Every time I'm tired, I'm tired, I'm tired. If you have constant tiredness with all these other symptoms, please come and get checked. Now, pelvic pain is one important sign of cervical cancer. Unexplained weight loss. All cancers will cause unexplained weight loss. Then leg pain as well. When it has started spreading, you could have leg pain as well. Okay, so how do we manage cervical cancer? Like I said, all cancers have basically similar type of management, and the treatment is based on the stage of the disease. So if you have any of the symptoms and signs we've mentioned, you come to the hospital, the doctor asks a lot of questions, takes your history, does a clinical examination, and then sends you for investigations, which will include routine investigations like your blood count, check the function of your liver, kidney, as well as doing a pap smear, which I'll talk about soon, and then biopsy of the cervix, which will give us a definition, a definite stage of the disease. And then the treatment will depend on the stage, which could be surgery, with or without chemotherapy, with or without radiotherapy. Chemotherapy is using drugs to kill cancer cells, while radiotherapy is using radiation to kill cancer cells. So now we talk about pap smear, very, very important. Just like breast self-exam was important for breast cancer, pap smear is very important for cervical cancer. What is pap smear? Pap smear is basically a screening test which we use to check people who are at risk of having cervical cancer. So the thing about cervical cancer in Nigeria that makes it a bit different from cervical cancer in developed countries is that in developed countries, there is already a protocol. Once you get to age of 20, between 21 and 25, really. So like UK uses 25, you will get a message asking you to go and get pap smear done. They will keep sending you that message every 3 years until you clock 66 years. So here in Nigeria, I'm very sure that most of us have not had any pap smear done. So we need to increase the awareness about this pap smear test, because doing a pap smear means going down to the cervix, taking some cells, scraping cells off of the cervix and checking it under the microscope to check for cancer cells. The good thing about cervical cancer is you could have the cervical cancer cells in the cervix and it will stay there for about 10 years without spreading. So imagine having cancer cells for a whole 10 years and you never found out. That is why we recommend doing the test every 3 years, so that immediately these cells start forming, we're able to give you some medications, do surgery, give some chemotherapy and radiotherapy. And in less than a year, you are cancer-free and you go about your life as normal. So is this not something important that people should know about? Now, in most countries, they start their screening from 21 years to 29 years. So people between that age group are asked to go for pap smear testing every 3 years, but they don't need to do the HPV screening. HPV screening is to screen for the virus itself. Now, from 30 to 65, remember we say cervical cancer peaks at the age of 30. People above 30 are at more risk of having it. So you have to do both the pap smear every 3 years and also add a HPV test every 5 years. Just like we go for HIV screening test or hepatitis screening test, there is also HPV test. I'm not very sure how much we have that in Nigeria, but at least we have the pap smear, so that's there. Now, from 66 years and above, they do not need to do more screening if they have had 3 normal pap smear tests. So, or 2 normal HPV tests in a row. That means they don't need to do more screening. But if maybe someone was treated of cancer, maybe at the age of 63 or 64, they will have to continue doing the test every 3 years of their lives. All right? So prevention of cervical cancer. We keep saying cervical cancer, the main cause is human papilloma virus caused by, it's a sexually transmitted infection. So avoiding promiscuous sexual activity is very, 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 very important. So as a family physician, we direct all our treatment and promotion health talks to a family as a unit, because the family is the unit of the society. So whenever you're sexually active, you try as much as possible to avoid promiscuous sexual activities. You use the condoms or other contraceptives during sex and try to stick to one partner, okay? Because even if you want to go astray, remember that you're going to put your partner at risk of having cervical cancer. And even if you don't even like that, your partner, when your partner gets cervical cancer, you will pay. You will be around to run around and take care of that person. So if you're not doing it for love, do it for yourself and don't put your partner at risk, okay? Quit smoking, please. Smoking puts you at risk of having so many different kinds of cancers. So quit smoking, quit hanging around people who smoke, and get HPV vaccines. So in developed countries, these HPV vaccines are quite abundant and available. Here, they are available, but at a very high cost. So we are still appealing to the government to see if they can reduce the rates of the cost of the vaccination so that it could be made easily available. For now, it's given to children from age of 2 to about 25 years or so. And then if you've not had any koitaki, if you've not had any sexual encounter, we are advised to get the vaccines before you start, okay? So vaccination is very important. Then regular pap smear, like I said, every 3 years. If you've not done the pap smear, if you know family members who haven't done the pap smear, they can go tomorrow to get the pap smear done. It is done in any teaching hospital in the country or any government hospital, and in some private hospitals as well. Then safe sex. Okay, we've said a whole lot of things about breast cancer and cervical cancer. This is just a very abridged version of the health talk because of time. So now we'll talk about supplements. What can we also add to all these preventive measures to help us boost our immune system and prevent having any of these cancers? And what can we also do if by chance we already have the cancer, we're undergoing chemotherapy or radiotherapy or planning for a surgery, or you have a family member who's also having these cancers? So we talk about aloe vera. Aloe vera is commonly known as the miracle plant because it has so many ingredients that helps to improve the quality of a person's life. And it also helps prevent cancer. And while undergoing treatments like chemotherapy and radiotherapy, it can also help to make your life better, to boost your immune system as well. So aloe vera, there are so many products that have aloe vera as their key ingredients. So we talk about this aloe vera gel here. This aloe vera gel contains more than 200 active compounds, which includes 12 vitamins, 20 minerals, 75 nutrients, 18 amino acids, and 97% pure aloe vera. So this is a very wonderful gel that can be used to boost your immune system and also boost the immune system of people who are also undergoing treatment. We also have the aloe berry nectar, which has 90% pure aloe vera and has antioxidants from cranberries and apples. We also have the aloe vera jelly, the aloe propolis cream, the aloe lips, and Forever Bright Tooth Gel. Because people who are undergoing chemotherapy have breakdown of cells that replicate rapidly, like the hair, the skin, the lips, so even the gums as well. So the Forever Bright Tooth Gel is a very important tooth gel to use because of the aloe vera components of the gel. Now we talk about the aloe heat for people having bed sores, aching backs and joints. We talk about the Abeta Care, which is also a supplement that has powerful antioxidants that help to boost your immune system. We talk about Lyshum Plus. It also has antioxidants, bioflavonoids, all these essential nutrients that also help, and they are used in treating toxic effects of chemotherapy and radiotherapy. So it's a very powerful toxin, a very powerful tonic. Then Forever Daily, we have other supplements that are also very important. So we talk about Vitalize Men and Women. These are supplements that are good for male and female reproductive system, as well as general well-being. And here, I want to talk about this Aloe Ever Shield. Remember, we talked about the risk factors for breast cancer. We talked about having cosmetic chemicals like aluminum salts that are in deodorants or antiperspirants that have been linked to increase the chances of having breast cancer. So this is one very important product that I found that contains no aluminum salt and is very good in it's very good as a deodorant stick and an antiperspirant as well. So I have been using it for quite some years, and I usually recommend it to people because of the increased risk of having breast cancer that comes with aluminum salts. So we also have other breast cancer control supplements like the Forever Abeta Care, A-Beta Care I talked about, Forever Daily, Forever Lyshum Plus. These are the other ones, aloe berry nectar, Forever Gel, Arginine Plus, and the toothpaste and the jelly as well. So there are so many products available for you to help prevent any of these cancers and to also help in the treatment of the cancers as well. Now, to summarize, for many, especially in Nigeria, a cancer diagnosis is perceived as a death sentence, and the financial burden of accessing care, as well as the lack of facilities, are faster killers than the cancer itself. Anyone who you tell, oh, I'm so sorry, I think you have, from the test results, you have cancer, they have already started going down, because where would they get the money? Okay, they have the money. How many radiotherapy centers do we have in Nigeria? So when you check that, you see that it's very, very important that we avoid the risk factors of breast and cervical cancer. We practice breast self-exam, or like I say, breast spouse exam, and then we do regular screening and report to the hospital immediately we notice any of these warning signs and symptoms of cancer. Early diagnosis and treatment is the key. So please, help me share this knowledge to your family members, to your work colleagues, anybody you can reach, so that we keep sharing and sharing this information until it gets across to so many people in Nigeria. Thank you very much for listening. I hope I've been able to pass some strong information across.
Honestly, I passed so many information that makes it very valuable presentation. Thank you so much. How do I describe you? As one of the, somebody that have read nutritional medicine or something? Did you read nutritional medicine?
No, I didn't.
Practice in US before?
No,
Yeah, modern doctor. God bless you. We are a good family doctor as well, and we pray for you. Wherever you have taken all these resources from, God will bless you and your family.
Thank you, sir.
This talk tonight is valuable, I'm sure. Not only those who are online now listening, even those who are not here must get this information because an awareness we are trying to pass across. And an appeal, I'm getting information here. Can we have the slides from you so that we can?
Of course.
Oh, thank you very much. Thank you very much. I appreciate it. All right, let's go to the questions first.
Okay.
If I may start from here, I saw one research from Readings University in UK. It said the continuous use of antiperspirants that contains aluminum salts, zirconium, and most of what you have mentioned here, they correspond to the increasing breast cancers now. Now we are on awareness talk. Not many people are aware that these antiperspirants, what we roll on there, here and there, to prevent sweat, they are the antiperspirants. They prevent us from sweating. So you mentioned something, a deodorant, Aloe Ever Shield deodorant, I can remember. Yes. I have a personal experience too, because if I use it, I still sweat, but there is no smell, there is no stain, and does not contain aluminum salts. So can we use this opportunity to also let people know the difference between the antiperspirants and deodorant that does not contain these? All right.
Okay, thank you very much for the question. I get it now. Okay, so antiperspirants and deodorants are two different things because antiperspirants actually are targeted at blocking your sweat glands, the opening of your sweat glands. So they prevent you from sweating, while the deodorants are not blocking those openings. So you can sweat, but then they are odor control. So the smell that comes with having a lot of sweat is being controlled. So that's basically the difference between having an antiperspirant and a deodorant. And yes, it's not only Readings University in UK, because while I was doing this research, I found a lot of articles from so many different universities, both in the UK, in Canada, and in US as well. And they've done a lot of research and have linked some of the breast tissues they've gotten from breast cancer patients and found some of these salts and cosmetic chemicals in them. So, well, I think it's very, very important to go through. If you go home, you check the products you're using, you will see these components that I'm talking about. And you see that when we use them for a very long time, from teenage years to adulthood, and it's rubbed at the armpits, and coincidentally, most of the lumps found in breast cancer is actually found at the lateral aspect of the breast, which is around that armpit. So it's been absorbed there and absorbed straight into the breast tissues, and it predisposes you to having breast cancer. So like I said, this product is very important and very good because it doesn't contain any of those salts, allows you to sweat as normal as you should sweat, but controls the odor that comes from it, and also does not stain your clothes. So I think it's a very wonderful product.
Thank you very much. In addition, I also read from somewhere why Nigerians use antiperspirants is because they don't like the odor or smell around the armpits. I found out that what causes smell is not our sweat, really. They said there's some bacteria that feed on the salt of the sweat, and then they also excrete. It's their waste products in millions that causes the smell. That is why this Aloe Ever Shield deodorant, aloe, basically aloe vera prevents those bacteria from coming around there, and so there's no smell. So if Nigerians are aware of this, then they should be able to shift, what they use, and then to be aware that smell is not caused by their sweat, but because of the bacteria. So they should allow themselves to sweat, not to block the pores, because I don't really know why Nigerians must still prevent sweat. So this awareness talk, I think, is very important to share that information. Thank you very much, Doctor.
Thank you.
So go now to the questions. People, let me see here. Yeah, people are like, please, we need questions now. send your questions to the chat room. Say, though I came in late, but was able to pick one or two things from the presentation. Thank you. Okay. I'm looking for questions. Please, Doc, can someone who has been sexually active still take the HPV vaccine?
Very good question. That actually shows you are listening. Okay, so initially, some 2 years back, the campaign has been for 2 years and above, children from 2 years and to 16 years, really, thinking most of them have not been sexually active. But I think there's been a shift because most people are having the genital warts, which is also caused by human papilloma virus. So when you come around, some centers will test you for the virus, the HPV virus, because the vaccine, I think, is against type 16 and type 18. It's not against all the HPV types. So when they test you for the particular types and you don't have that, then they can go ahead and give you the vaccine, irrespective of whether you're already sexually active or not. I hope that answers the question.
Yeah. Okay, there's a question here. Ade Kanye, same advice for the other persons experiencing lactation 16 years after her last delivery. She should go to hospital. I hope this will help. I don't know what this person is writing now.
Okay, no, I think I got the question. Thank you for that. So I think what the person is trying to say is someone has given birth and after a while is still experiencing lactation. That means nipple discharge.
Okay.
So if that's the question, yes, the person should go to the hospital because the age of this person is also something we have to consider. And how long ago did the person stop breastfeeding? So generally, most people who stop breastfeeding less than a year or two will still have some nipple discharge, which is, well, subnormal because it's caused by an increased level of the hormones, the prolactin hormone that I mentioned. So when we give them some hormonal drugs, it reduces and then the discharge stops. But you would always advise, if you notice anything, any of the signs and symptoms, nipple discharge, please come to the hospital. So we'll do a comprehensive check and make sure that that is not a warning sign of breast cancer.
Okay, that's good. I hope everybody benefiting from this. Doctor, can we now go to this cervical? Because I am aware from what I'm seeing, most men are also listening because you mentioned promiscuity, indiscriminate sexual activities. What advice can you give to men?
Well, generally, we all know what's happening in the world right now. There's been a very increase, a surge in sexual promiscuity going on around the world. And of course, Nigeria is not left behind. So we ask you, at what can you afford to give your partner, or is your partner cervical cancer? Because the promiscuity is so high that some people don't use barrier contraceptives anymore. So we keep advocating and advising and preaching and begging. Please stick to one sexual partner. And if you cannot, please use a condom so that you don't keep passing so many different kinds of sexually transmitted infections like this human papilloma virus that we are talking about to your spouses or other women who are not aware that they could have cervical cancer from having sexual intercourse. Thank you.
Thank you very much. There's a question here. I hope it's relevant to this issue. Say, please, if someone has benign cysts for a couple of years, is there any drug that can dry it up?
Benign cysts. It depends on the location of the benign cyst. Because in medicine, when we keep abnormal cells in any part of the body, with time, they tend to develop into cancer cells. So we always advocate that when you find any lump or any swelling or any abnormal rash on your body, you come around so we take a look at it. Sometimes we'll monitor it for a couple of months or years, and if it's still increasing, we would advocate to have it removed and tested in the lab for cancer cells. This takes care of two things. One, it doesn't keep staying in your body to have that chance of developing into cancer. And when we test it and it's a pre-cancerous cell, we can start the treatment on time to make sure it doesn't spread. So please go to the hospital so that the doctor will take a look at it and then advise you properly on what next to do. Thank you.
Yeah. Thank you very much, Doctor. I'm checking for questions here, and it does appear that we don't have more questions. Okay. Yeah. Working in pathology in my previous profession, I personally witnessed the presence of aluminum fibers in patients with breast cancer. That's Josephine from somewhere. I'm sure she's collaborating what the research people have done. Aluminum salt and all that found in fiber, which makes it dangerous. Okay.
Thank you very much for that.
Yes. Please, if somebody. Okay. My daughter placed an open aloe vera gel bottle in the freezer. Does it affect its efficacy?
It's a very good question.
Yes. So
yeah.
Can you do that?
Okay, just to react to that, it depends on how long it's been open and how cold the fridge has been for a while. So it can stay in the refrigerator for about a week or two, but it shouldn't stay more than that. And if it's been open for a while, that means you've the risk of having it infected with different kinds of organisms that also stay in the fridge as well. So we advise you to throw it out and then purchase a new one so that you're very sure of how safe and effective it is. Thank you.
Okay. Yes, doctor, there's a question here. Please, doc, what can one do if the cervix area has small growth like a rash and the pap smear has been done and it's okay, but the rash didn't go, or maybe the rash didn't go? What can one do?
Okay, that's a very beautiful question. So the cervix, today's topic is on cervical cancer, but there are still so many different kinds of benign diseases of the cervix, which means diseases of the cervix that are not cancerous. So we would advise you to go and see a gynecologist. I'm sure you must have seen one to have done a pap smear already, but you could have a cervical polyp. You can have so many other conditions of the cervix, which will not form cancer. But remember, you have to repeat that pap smear every 3 years from now on, so that we are sure that this growth there does not transform into cancerous cells later in life. And then you can also see a gynecologist who will take a look at it and then diagnose it properly and then tell you what to do about it. Okay? Thank you.
Yeah, this one is very interesting question. So why does most breast cancer start from the left side of the breasts?
Well, I can't really say why. Okay, but
does it start from the left-hand side, really? Often?
Research has shown that I think more than 50% of the incidences start from the left side. Yeah. Actually in the research, but we can't really say why. So maybe it's one of those things.
All right. Well, when I did MBA, there's one professor that took us a computer. If you ask him too many questions, say, why is electron? He said, "Nase mama bona." There's no way you can explain it further than this. All right, thank you very much, doctor. We cannot thank you enough. And sincerely speaking, I'll tell you that what you have done today has impacted so much value on people. And what we do usually is after the presentation, we don't leave it like that. Your presentation materials we want to share to as many people as possible. And if there is need for you to also, if you want us to give out your contact, so many people want to call you to ask for some details or what they do and how they can reach you. Is it possible for you to give us the contact?
I'll get back to you on that.
It's all right. And you can actually reach Dr. Clements if you want to do that, so that we can give that. Because many people are really, after the last program, they're like, how I want to ask doctor question. I want to ask doctor question. So if you can send it to doctor, we'll find a way to let only those who need to get at you will give your number to. So I want to thank you once more. Please and please always oblige us each time we call on you, because we see that you are like a bridge between the past and the future. And your presentation appears to be very, very well aligned with what people want today. And so there's always a popular demand to say, please, can you get us that doctor, please can. So thank you once more. Thank you once more, and God bless you and your family. All right.
Thank you very much.